ES Audio.
From the Evening Standard in London, I'm John Weeks, and this is The Leader. As the UK holds on for what will hopefully be a more normal Christmas for many this year, there are some positive signs that the rise in cases of the Covid-19 Omicron variant is slowing in London. For the sixth day in a row, cases have been in the 20,000s, with the lowest number recorded on Tuesday. But the number of coronavirus patients in the city's hospitals has jumped by 830, or 77%, since the start of the month to over 1,900. They are expected to rise further because trends in hospitalisations tend to follow those of cases by around a week or two. Now, the Evening Standard's political editor, Cecil, has been looking at the data. So, Nick, what is the situation looking like in the capital?
Well, there are hopeful signs that the exponential surge in Omicron cases in London may actually be slowing. It's still far too early to call it, but if you look at the figures over the last 6 days, they have ranged between 20,491 confirmed infections announced on Tuesday and 26,608 on Friday, the previous Friday. And if you look at this 6-day period, the most recent 3 days are actually lower than the previous 3 days. Now, health chiefs, they look at disease trends over a longer period, so it's really too early to call. But it's a hopeful sign that maybe, just possibly, that the wave is not quite as ferocious as it was previously. These figures will have been influenced by the weekend testing, and they tend to be lower at the weekend, so we've got to take this into account. It could also be that some people aren't getting tested because they don't want to self-isolate for Christmas. But even if you take that into account, it doesn't look like we've got exponential growth at the moment.
Obviously, we'll need to keep looking at the figures day by day, but what could this slowing of case numbers mean?
First of all, what this trend, if it does turn into a trend, seems to suggest is that whatever measures are now taking effect are keeping a lid on the rising cases. So health chiefs think that they may still be rising, but not quite as fast. And so the factors which could influence that, one is that Londoners are mixing less at work, less socialising, and are actually following the advice of Professor Chris Whitty, who suggested that we should prioritise our social mixing to combat Omicron. It may also be that the boosters are working. Obviously, as people who've been boosted several weeks previously, that'll probably have the most impact. And also that Plan B, the Plan B restrictions, including working from home and vaccine passports and so on. So if you combine those together, that may be stopping this massive surge in Omicron cases.
And if that is the case, and these current measures are working, most people would take that, wouldn't they?
Yes, so certainly if this doesn't work, we're looking at stricter measures. And that may not be a full lockdown, but that may be a form of circuit breaker, possibly for 2 weeks. And that could include less mixing between households. It could mean pubs and restaurants only able to serve outdoors. So obviously that would have a bigger impact on people's lives than the current measures. And I suspect what we might be seeing is that people, Londoners, are beginning to understand how to live with the virus. So inevitably there'll be new variants, inevitably there'll be new ways. But maybe we just now need to know that if there's a way, then we have to do a bit less socialising. And then when that subsides, then we can enjoy life a bit more.
Now, there's some data released today, reportedly from the UK HSA, which suggests Omicron could cause milder disease than Delta. There is still a worry that hospitals will struggle, though, isn't there?
We haven't had any report officially from the UK Health Security Agency today. There's a report, possibly a very good exclusive, from Politico Playbook, which they're predicting that they say they've had a tip-off about what the report will say. And the key things are, for example, that for most people, the Omicron variant is likely to lead to a less severe disease than the Delta variant. This may be partly due to the level of vaccinations already in the country, but that there could still be a very large number of hospital admissions. Now, on this, the focus is very much on London. because London is the area of the country which has been first and hardest hit by Omicron. And at the moment, there are just over 1,900 coronavirus patients in the city's hospitals. Admissions are going up, not massively, but significantly. And so that 1,900 figure is expected to rise.
Now, obviously, we know the booster campaign is going well so far. Yesterday, the Chancellor announced support for the hospitality sector. Do you think London and the UK more broadly will cope better with this wave of COVID compared to the others we've experienced?
These measures will definitely help, but it depends very much how long this Omicron wave lasts. If it's very short and sharp, which it may be, there's some evidence from South Africa to suggest that, but it'd be foolish to predict that or to rely on that. So certainly the Chancellor has come up with this £1 billion package. This includes one-off grants of up to £6,000 per premise. That will help, but many firms are saying that will go nowhere near enough for many businesses. And you've got to remember, a lot of these businesses have now suffered 3 lockdowns. So they would have built up significant amounts of debt, and they've just been getting through. And certainly these measures will help, but certainly if it goes on for any length of time, then they'll be desperately calling for far more help. And some of them are already saying they need more help than what's been offered.
There's more on this story in the Evening Standard newspaper and at standard.co.uk. That's The Leader. We're back tomorrow at 4 p.m.